It addresses arrhythmia, also known as an irregular heartbeat. So we're discussing cardiac ablation. Our guest is Dr. Tamjeed Arshad. He's a cardiologist with Jackson Hospital. This is Vital Signs, candid conversations with providers who care from Jackson Hospital. Thanks so much for joining us. I'm Joey Waller. Hi, Dr. Arshad. Welcome.
Thank you. How are you, Joey?
I'm good. Yourself?
I'm fine. Thank you.
Excellent. Appreciate the time. So first, what exactly in a nutshell, doctor, is heart ablation for those unfamiliar with it?
Heart ablation is a procedure that causes disruption of the heart tissue by various technologies, most commonly radio frequency energy, but more recently, pulse field ablation and cryoablation.
And so there are different types of irregular heartbeats, am I right? So what are those exactly?
That is correct. So the heart arrhythmia or irregular heartbeat, as you said, consists of supraventricular tachycardia or arrhythmia and ventricular tachycardia or arrhythmia, depending on what part of the heart they're originating from. Supra means above the ventricle, and ventricular means from the bottom chamber or the ventricle part of the heart.
And so that being said, which patients are candidates for an ablation, and are there any for whom it's not recommended?
More or less, most of the arrhythmias can be ablated these days. So the technology has advanced that most of these arrhythmias can be ablated using one of the technologies that are available now.
And so what's the benefit of an ablation for both the patient and for the physician like yourself?
So for most arrhythmias originating from the atrium or the supraventricular part of the heart, it is a curative procedure. So if it's done, it means that arrhythmia is gone for good. There is a rare exception, which is the atrial fibrillation, which still has a high rate of recurrences even after ablation. Having said that, it does provide better outcomes as compared to medical treatment. Regarding the ventricular tachycardias, arrhythmia, again, the ablation provides better outcomes as compared to medications alone.
And how about for the physician? What are the advantages there?
First and foremost is the fact that you can cure somebody, which is very welcoming. So that's a positive feedback from that procedure. And also to improve the quality of life for that person as well. So that's always something that's hardly you see in some other branches of medicine. I mean, for cardiac arrhythmia, it's very successful in that arena.
And so how would you say ablation compares with, say, getting a pacemaker instead?
So different procedures. Pacemaker usually is for somebody with a slow heart rate. Ablation, on the other hand, is somebody with a faster heart rate. So it's totally different ways of approaching a cardiac arrhythmia.
Gotcha. And so when we talk about ablation, can you describe the procedure itself, what's involved, how long it takes? What should patients know about this?
So most of these procedures are done under conscious sedations, which means that you don't undergo a general anesthesia procedure. It involves accessing blood vessels in either the legs or the arms and putting catheters through the blood vessels inside the different chambers of the heart, recording electrical signals, pacing the heart, trying to induce that particular arrhythmia, then mapping its source, confirming that source, and then ablating that area. So it's a stepwise procedure. It can take anywhere from an hour to maybe 2 to 3 hours, depending on the site from where it's originating from and the nature of the heart disease.
And then how about recovery time and rehabbing afterwards?
Again, for most arrhythmia, it's a same day procedure. So they have it done, go home later that day. However, depending on the underlying heart conditions, and especially with the ventricular tachycardias, they may have to stay overnight to recover.
But you say many do go home the same day. I mean, when you kind of take a step back and think about that, it's pretty
Yeah,
amazing, right?
it is. Oh, yes. The way the technology is advanced, most of these patients get to go home 5 hours later.
So, how about risk? Obviously, there are risks associated with most any medical procedure. How about here?
Absolutely. I mean, there's nothing risk-free in medicine. However, the risk is very small, especially with the common arrhythmias that we ablate on a day-to-day basis. The risk of any major, like major bleeding requiring transfusion, heart damage, heart attack, stroke, etc., would be of the order of 1 to 2% or less.
Wow. Interesting. So,
Yeah.
how about the fact that when we're talking about the heart doctor, I would imagine patients are obviously concerned when they have to go through a procedure like this or any heart procedure, but there's also fear, isn't there? And understandably so. How do you walk patients through that to let them know that they're in great hands with you and yours and that this is all going to work out in the end?
Everybody has some level of anxiety and fear about the procedure, but with the data at hand from years of doing these procedures, we try to allay that fear that it's a low risk procedure with great benefits. And I think we certainly allay those fears in most of the cases.
And so you touched on it earlier, but if you could expand a bit, please, when we talk about improving quality of life, what kind of a difference is the typical patient going to see in that after undergoing this procedure?
I think for some it's phenomenal because the arrhythmia can be debilitating. You're having their heart beating fast almost on a daily basis, with associated symptoms like dizziness, shortness of breath, and to be arrhythmia free, it's night and day for some of them. Oh, absolutely. I mean, they feel 100% better.
And we just talked about fear. I would imagine it's scary to have to live with that condition, knowing that
Oh, yeah.
there's an unpredictability to it.
That's right. That's true. I mean, especially with arrhythmias where heart rate beating fast and irregular, some folks do pass out. And so that's another serious side effect associated with some of these arrhythmias.
And when we talk about quality of life as well, how about a few of the things from your experience that after undergoing this, patients tell you they're most happy about being able to return to because they had to stay away from certain things until this was done?
Oh, yeah. I mean, they can go back driving for somebody who couldn't drive, or they can take trips now. They were scared to go outside the house or to another city. Now they're enjoying their life, they're traveling. So, yes, several of my patients have said that.
A healthy heart doctor, it's something that most of us probably take for granted until it's not so healthy, right?
That's true, especially with the way the culture is in terms of diet and less exercise. And of course, most the population is aging, so does causes more heart conditions, which we see on daily basis.
How about the importance of, to your point, getting your heart checked on a periodic basis, especially when you may be at risk because you're either getting older, as you point out, and or aren't the healthiest in terms of weight, not enough exercise? How about the importance of at least making sure you know what's going on with your heart?
Yeah, absolutely. I think it's very important, especially if you do have a family history. And if you, again, are obese, overweight, and other risk factors, diabetes, hypertension, smoking, all of those, I think it's important to seek a specialized evaluation from a cardiologist, getting at least a baseline EKG, sometimes stress or other studies to see where things stand.
Couple of other things for you. If left untreated, what are some of the most common dangers of an irregular heartbeat?
It could be minor to severe. Minor would be heart palpitations, dizziness, lightheadedness. And then as you expand further, passing out spells, and some people can even die from arrhythmia, sudden death.
So, yet another reason for people to stay on top of it,
That's right.
right? As we touched on a moment ago. How about personally for you? Why cardiology for you? Where did you initially get an interest in treating heart patients?
Well, it was during my residency time in Boston. That's how I got interested in cardiology, and from cardiology into electrophysiology, which deals with the arrhythmia part of cardiology. Working with some of my mentors over there, I developed this interest, and I'm happy that I stuck with it.
Yeah, talking to doctors in recent years, I find that those early mentors are so influential, aren't they?
Oh, yes, absolutely. I agree 100%. That initial impression, guidance from a good mentor carries a long way.
No question. And then finally, doctor, in summary here, for those joining us that may be candidates for this ablation procedure, what's their first step?
I think first step is you don't ignore your symptoms and seek help. The sooner the better, because most of these arrhythmias can be cured, and if not cured, can be made less burdensome.
Yeah, great advice. Don't ignore the symptoms. Well, folks, we trust you're now more familiar with cardiac ablation. Dr. Arshad, keep up all your great work, and thanks so much again.
Oh, thank you for having me.
Absolutely. And for more information, please visit jacksonclinic.org/specialty-care/heart-failure-clinic. Now, if you found this podcast helpful, please do share it on your social media. I'm Joey Waller, and thanks so much again for being part of Vital Signs, candid conversations with providers who care from Jackson Hospital.